I remember the first medication error that I made. And it was a long time ago.
I experience the same emotions even today, thinking back on that day more than 10 years ago.
Many, many years later, this is 30 plus years later, I still remember that. I was a young resident.
I'd only been nursing for about a year and a half.
I was on a rotation at Toronto General Hospital.
When I was a surgeon in Houston, I left a retained sponge inside a patient.
I was told to admit a patient to receive standard chemotherapy for treatment for one type of leukemia.
It was a dose of codeine that, as I was pouring it, I thought, this isn't right.
And I pulled a binder for acute leukemia without checking what type of acute leukemia.
I thought I read the order. I thought I read it right, and so I didn't question it.
It was signed off by everyone involved, by the pharmacist, by the nurses, the drugs was given.
And even the patient, when I took in the medication, questioned the amount that I was giving her.
I knew the feeling that I felt as I walked down the hallway to talk to the patient's wife.
It turns out I was giving treatment for one type, myelogenous leukemia, instead of lymphocytic leukemia.
I actually gave her 50 times the amount of medication she should have had.
I can remember everything. The pain, the shame, the embarrassment that I felt.
I was petrified that I'd harmed her. I was petrified I was going to get into trouble.
I hate myself for not actually looking back on this previous chemotherapy treatment before I ordered it.
I could feel the shame as I went back to the operating room 12 hours later to retrieve the sponge. 20 minutes later, the problem was solved.
I remember telling her, I really made a big mistake. I gave you too much medication.
I could have killed a guy. It just so turned out in that particular case, it was a minor differences in chemotherapy. But what if the mistake was worse than that?
That is one of the most terrible moments of your professional career.
I know many nurses and physicians who've made huge mistakes that it's wounded them forever.
I learned to forgive myself because had I not done so, I would have quit medicine back in 1982.
If you can't forgive yourself, if you can't see it as a learning opportunity, then it will destroy you.
What I learned about forgiveness is as following. The overwhelming majority of our patients and their families, they're forgiving. The overwhelming majority of them, when they actually realize that we are honest and we disclose our errors and mistakes, they actually forgive us and give us the chance to move on.
It was transformational for me in many ways and crystallized my own passion for safety.
It makes me give people the benefit of the doubt that there's more complexity to the issue.
When errors occur in healthcare, they are rarely the result of one single person, of one single act.
As leaders, we need to talk about those failures.
The onus is on us to actually seize that opportunity, to actually learn from it.
And not keep it to yourself, but share it with others.
The success will mean that we will convert error into near miss. And we should celebrate the near miss.
I've learned that safety is something that needs to be integrated into everything that we do, all the time, every time. Caring safely will never end.